The first antiprotozoal drugs we'll discuss will be anti-amoebic drugs. Entamoeba histolytica causes amoebiasis, which is a protozoal infection transmitted via fecal-oral route. This disease has two forms. One is the intestinal form and the other is extraintestinal. The drugs that are used in amoebiasis will be classified upon the fact if they're effective in both intestinal and extraintestinal amoebiasis, or if they're effective only in intestinal amoebiasis, that is, they are luminal amoebicides, and if they are only effective in extraintestinal amoebiasis. The first type of drugs, which are effective in both intestinal and extraintestinal amoebiasis, are further classified into nitroimidazoles and emetines and dihydroemetines. Coming to the nitroimidazoles, the prototype drug metronidazole is effective against anaerobic bacteria, remember that, and several protozoa such as Entamoeba histolytica, Giardia, Trichomonas vaginalis, etc. The mechanism of action is actually metronidazole is a prodrug that is converted by the protozoal enzyme nitroreductase that will reduce the nitro group of metronidazole and convert it into the active metabolite, which is cytotoxic to the protozoa and will damage the DNA and thus will have a cidal effect. It can be used orally, IV and topically, and it reaches good concentration in body fluids. Side effects can include mild GI side effects, allergic side effects, CNS toxicity, and a special side effect to remember is disulfiram-like effect and also metallic taste. Metronidazole is contraindicated in pregnancy because it has a teratogenic effect, and drug interactions will include metronidazole potentiating the anticoagulant effect of warfarin by inhibiting its metabolism, and also potentiating lithium toxicity by decreasing renal clearance of lithium. Metronidazole is the first line of drug for amoebiasis. It is also used in Trichomonas vaginalis, and both sexual partners are treated in this case. Metronidazole is very effective in giardiasis and other anaerobic infections such as those caused by B. fragilis and Clostridium difficile. If you remember, metronidazole is the drug of choice for pseudomembranous colitis caused by this organism. It is also used in H. pylori infections and Crohn's disease. Other nitroimidazoles are tinidazole and ornidazole, which are both longer acting and better tolerated than metronidazole, and lastly cetranidazole, which does not have a disulfiram-like effect. Coming to the emetine group, it includes emetine and dihydroemetine. Emetine is the alkaloid and dihydroemetine is the synthetic form, semi-synthetic derivative actually. And as they are alkaloid derivatives, that's why they are irritant, bitter and nauseating. That's why they should not be given orally. They are given IM. They will kill the trophozoite form and they are very toxic. That's why they are used secondary to metronidazole if that doesn't work. There is a long list of adverse effects that can be remembered with the mnemonic emetine. E for emesis, M for muscle weakness, ECG changes, tachycardia, itching, nausea, and eczematoid lesions. Next are the luminal amoebicides, which are only used in intestinal amoebiasis. They include amides, iodoquinol, and antibiotics like tetracycline and paromomycin. The amides further include diloxanide, furoate, and nitazoxanide. The diloxanide furoate form will kill the trophozoites in the lumen. Its mechanism of action is by splitting into diloxanide and furoate. Diloxanide will be partly absorbed while the furoic acid, furoate, will have the anti-amoebic property. It is the drug of choice for asymptomatic amoebic carriers and usually mixed with a tissue amoebicidal to completely eradicate the infection. Side effects can include flatulence, nausea, and rash. While nitazoxanide active form or active metabolite is diazoxanide. It is both used in amoebiasis and giardiasis. Iodoquinol is very toxic, causing thyroid enlargements, iodine toxicity, neurotoxicity, etc. So it is not used. Antibiotics such as tetracyclines and paromomycin are used. Tetracyclines will reach the colon where they will inhibit or destroy the bacterial flora that are needed for Entamoeba histolytica, which use them as food by phagocytosis. Paromomycin is the aminoglycoside which is safe in pregnancy in case you cannot give tetracyclines, which of course you cannot give. Lastly, the only extraintestinal amoebicide is chloroquine. It is used in hepatic amoebiasis and has good gut absorption. Mostly it is absorbed in the upper GIT and gets concentrated in the liver where it acts. Other antiprotozoals will only see their names and their uses. First is miltefosine, second is sodium stibogluconate, pentamidine, we've already seen this before, suramin, metarsoprol, and pyrimethamine, we've already seen this one as well. Miltefosine is used in visceral leishmaniasis. Sodium stibogluconate is used in cutaneous as well as mucocutaneous leishmaniasis. Pentamidine is used in leishmaniasis as well as pneumocystis aerowetzi infections in HIV patients. Suramin is the drug of choice in African trypanosomiasis or sleeping sickness disease, and it is used before the CNS is involved. It can cause neurological complications. Melarsoprol is also used for African sleeping sickness, and this drug enters CNS, and that's great when CNS has been involved in the disease. On IV administration, it may precipitate fatal reactive encephalopathy. While pyrimethamine is used in toxoplasmosis. That's all about antiprotozoal drugs.